Hello everybody, how's everyone doing today? Today we will be doing stuff. I will be doing research, and if there's a video on YouTube that I need to watch or something, perfect. Oh really? I did some research about ADHD recently actually. The last Just Chatting stream, Just Chatting numero dos, Which is very interesting, actually, of a topic. I wanted to look something up, hold on, that had to do with it again, because I looked it up before on the last Just Chatting stream. How common, oh shit, hold on. How common is it to have both autism and ADHD? Let's check this out. If I can spell properly. Between 30% and 70% of individuals with autism also experience ADHD symptoms or have a formal ADHD diagnosis. Ooh, okay. Between 30% and, what did it say, 70%? Okay, let's read more about that. Hold on. The combination of ADHD and ASD, often referred to as ADHD, one of my tags is ADHD, AUDHD, is quite common. Research suggests that between 30% and 70% of individuals with autism also experience ADHD symptoms or have a formal ADHD diagnosis. This high comorbidity rate is also reflected in the fact that a significant portion of individuals diagnosed with ADHD may also have features of autism. Okay, interesting. Studies indicate that a substantial percentage, a large percentage of individuals diagnosed with autism also meet the criteria for ADHD or experience significant ADHD symptoms. Oh, interesting. Conversely, a notable proportion, of individuals diagnosed with ADHD might also have autism or show autism. I get that. A lot of it, I suspected, like how data is unreliable because the older peeps get them, or effective they are at masking and coping. I know, right? That is pretty hard. But there's a pretty high percentage of people with ADHD and autism, or autism, to have them both. Thank you. I don't know, I find that interesting. I have a lot of things that I probably looked up before. You know what? I wouldn't doubt that you're autistic. But I'm also not a doctor, so you'd have to get, like, a doctor to do that. I think I looked up how they... I think I remember looking that up before. Hold on. Did I not look that up before? Yeah, I looked up what information is needed for an autism diagnosis before. I want to look up what is PDDoS. Oh shit, I forgot I had to actually look that up medically. At this point, it wouldn't make much difference. Well, yeah, you don't have, like, if it makes no difference, if you can function just fine, I don't see a point in, getting checked out for that. Hold on, let me just, I think I put it on Twitch stuff. Research, right? Where did I put this? Because I want to be able to put links to some of the sources. Hold on. I remember, research right here. medical things. There we go. Perfect. I think that's right, isn't it? I don't remember where I put it. Just check. Okay, I figured it out. Never mind. Hold on. Just gotta find it now. Just chatting research. There we go. There it is. Okay, sorry about that. Pervasive developmental disorders, otherwise known as PDD, now known as ASD, autism spectrum disorder. Okay, I see. Are a group of developmental delays that affect social and communication skills. The typical onset of PDD occurs around age 3. Some parents have symptoms during infancy. Treatment typically involves therapy and medications. Okay. What is PDD? I mean, it is otherwise specified, but... diagnosis. I wanted to know, like, specifically PDDOS. PDDOS or whatever. You can't prevent it. Somebody actually asked if you could prevent it. That's crazy. I don't doubt that. OCD is one of those things. PDD-NOS. I think that's what it was. I looked up into that too. If you let me see if I looked up into that completely. Oh, I haven't looked that up. Hold on. Not otherwise specified. Okay, let's see. PDD-NOS was one of several previously separate subtypes of autism that were folded into a single diagnosis. Okay. Past psychologists and psychiatrists often use they use that interchangeably with ASD. As such, PDD-NOS became the diagnosis applied to children or adults who are on the autism spectrum but do not fully meet the criteria for... Okay! I think that's what I was looking for. Hold on. Wait, that's NOS. Hold on. Oh, no, that's right. Okay, I want to write this down. I want to write some of this down. So, diagnosis applied to children or adults who are on the spectrum that do not, but do not fully meet the criteria for ASD diagnosis. Okay, that's good to know. Okay, I see. Okay, so it's basically autism without the diagnosis of autism, I guess? Okay. Interesting. Now, I looked up what is ODD and DMDD already. What is that? What is Asperger's syndrome? Which is not a real thing anymore. A neurodevelopmental condition characterized by difficulties with social interaction, repetitive behaviors, and restricted interests, but without significant delays in language or cognitive development. Okay, it's often described as a high-functioning form of autism. Okay, I see. Okay. Okay, I don't remember looking this up. How severe can OCD get? Oh, I looked this up before already. Okay, I already looked that up. Okay, never mind. What characteristics does OCD have? Okay. Intrusive, unwanted thoughts, images, or urges. These thoughts are repetitive and cause anxiety or distress. Common obsessions, fear of contamination, fear of harm to oneself or others, unwanted sexual, violent, or religious thoughts. Need for symmetry or exactness, fear of losing or misplacing things. Okay. Okay, so I think I did look this up before, didn't I? Let's look at the Mayo Clinic real quick. Okay, symptoms, obsessions, symptoms, okay. Examples of obsession symptoms include fear of being contaminated by touching objects others have touched. Thoughts that you've locked the door or turned off the stove. Intense stress when, well, that's just an example. Intense stress when objects aren't orderly or facing a certain way. Images of driving your car into a crowd of people. I've never heard that before. Okay. Thoughts about shouting obscenities or not, acting the right way in public. Unpleasant sexual images and staying away from situations that can cause obsessions such as shaking hands. Huh. Interesting. That makes sense though, Pocket. That if you want to go in just to be sure of yourself, then yeah, that makes sense. Let's see. So I looked up the difference between DMDD and ODD. Do I even have that? Yeah. Disruptive mood dysregulation disorder and oppositional defiant disorder. What is ODD though? ODD, from what I read before, ODD is behavior, while DMDD is mood. So yeah, behavioral disorder characterized by persistent patterns of negative, defiant, and hostile behavior towards authority figures. Okay, so I do have ODD. That's what I know I was diagnosed with ODD, but like, interesting. Now, I don't remember if I looked this up before. Oh wait, hold on. Other specified dissociative disorder. Okay, so SDD, or other specified dissociative disorder, is a category within a larger group of dissociative disorders. Oh wait, hold on, did I miss something? Okay, no I didn't. It's used when an individual experiences significant dissociative symptoms, like memory gaps, detachment from oneself or reality, or identity confusion, that cause distress or impairment, but don't fully meet the criteria for other dissociative disorders like DID or dissociative identity disorder. Essentially, OSTD is diagnosed when someone has a dissociative disorder, but it doesn't neatly fit into the other established categories. Okay. So, I'm going to write that down. What was it? Dissociative disorder? If I can spell correctly. Dissociative. disorder that doesn't fit with common or need doesn't fit in with other established categories. Good to know, good to know. Hi, Darth. How are you? I'm not short. I'm 6'1". But hello, who are you again, Darth? I recognize your name somewhat. Okay. Bum bum bum. Bum chicka bum 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 chick. Let's see what else is there. How does one get diagnosed with OSDD? To be diagnosed with OSDD, a mental health professional will conduct a thorough assessment, which may include interviews, psychological testing, and ruling out other potential medical or mental health conditions. The diagnosis hinges on the presence of dissociative symptoms such as disruptions in identity or memory that don't fully meet the criteria for DID. Okay. That's good to know. I forgot what I was doing for a second. Alright. Now, we heard about DID a lot. What is DID? DID, formerly known as multiple personality disorder, is a mental health condition where a person experiences two or more distinct personality states or identities that recurrently take control of their behavior and thoughts. Okay, that's good to know. It is a severe form of disassociation, a mental process that disrupts the normal connection between a person's thoughts, memories, feelings, actions, and sense of self. DID is often associated with childhood trauma. I've heard that, and I know that to be true because I knew people and know people possibly with it, you know. And it's considered a coping mechanism to deal with overwhelming experiences. That makes sense. Okay. DID involves a significant disruption of the individual's sense of self with two or more. Okay. Not a split personality. DID is not the same as split personality disorder, a term often used colloquially in which is a misnomer. Oh, I have to look that up. What is split personality disorder? Split personality disorder. What is the difference between split personality disorder and... What was I doing? What's the difference between split personality and DID? I wonder if SPD is the thing. What is SPD? That is not the right one. Split personality disorder. What is it called now, actually? Let's... Hold on. It's outdated term for DID. So it's literally the same thing. I don't get why it told me something different. Interesting. Interesting. Hey, Pocket, you still there? Because I can keep adding questions for if you have a question that you want me to look into. I didn't even look up a video or something. I think I already looked that up. Hold on. DID. Okay, I'm just making sure. Hold on. Let's see. I did a paper on borderline personality disorder, but hold on. I know it's borderline personality disorder. I did this before. What I do know about BPD, though, is it cannot be cured, and it can be treated, but not always successfully. If I remember correctly. How, like, psychotherapy or something like that? How to treat BPD. Psychotherapy, particularly dialectical behavior, or DBT and CBT, cognitive behavioral therapy, and dialectical behavior therapy, is considered the gold standard for managing BPD symptoms. Medications such as antidepressants and mood stabilizers may also be used to address specific symptoms like depression, anxiety, or impulsivity. Okay. How to treat BPD. Psychotherapy. Dialectical behavior therapy slash PDB, cognitive behavioral therapy, CBT. Sounds like a slimmer case of schizophrenia. Hold on. It could be. If I can spell right, depressants or mood stabilizers. Okay. Sorry, I was reading that. Diagnosis and treatment. There we go. Mayo Clinic. Perfect. That's exactly what we need. Okay, let's see. BPD, a mental health condition characterized by long-term patterns of unstable emotions, impulsivity, and difficulties in relationships. Individuals with BPD may experience intense and fluctuating emotions, kind of like bipolar, but not really. Engage in risky behaviors, have unstable self-images, and struggle with interpersonal relationships. So what was it you said? You said... What is the difference between BPD and schizophrenia? Hi Rex, how are you doing today? I love you, yeah. Okay. Oh, they have overlapping symptoms. Got it. Okay. So the difference between BPD and schizophrenia are they are distinct mental health conditions with overlapping symptoms. Wait, what did I apologize for? I forgot what I apologized for now. You can remind me, if you can remind me though, Pocket, that would be great. But what I apologize for. Okay. Oh, okay. What are the differences in... If I can I not spell schizophrenia? Okay. Did that. What are the common characteristics of BPD? What are the common characteristics, if I didn't already look that up, of BPD? I wanted to become a therapist at one point. Because I was like, I'm empathetic enough where I think I could. Hold on. Sorry, I had some problem with eating. I don't know why though. Okay, BPD is characterized by a pervasive pattern of instability in relationships, self-image, and emotions alongside significant impulsivity. Wait, doesn't BPD... Hold on, let me check. Do BPD and autism overlap? They do overlap. They overlap quite a bit. I have a Reddit thing that shows something, but... You know what else? If I can save it, hold on. There's an image where it's like... Oh, ADHD, autism... All three of them? Okay. Interesting, I'll save that. Hopefully that doesn't ever get deleted. So there's a lot that... Hold on, neurodivergent insights. Hold on, maybe I can save this. Okay, I'll probably need to save this one too. Okay, here we go. I do have a link that I will be putting, maybe not in the... Okay, I found it. Okay, good. I don't want to read all. If anyone, especially in the chat, wants to read this particular thing, there are a few things on there, a few pictures. I just posted the link in chat for people to look at. Let's see, is this document? Okay. But there's a lot for a lot of this stuff. Okay, that's interesting. I don't want to read too much of this because it just feels like too much. At least to me it does. Okay, interesting. What are the common characteristics if I can spell right, characteristics of BD. Bipolar disorder. Some of the extreme shifts in mood, energy, and activity levels impacting daily functioning. These moods. Okay. Wasn't it you, Pocket, that said that not that long ago that somebody in your family has that? Your mom? No, your mom had bipolar, right? Yeah. Might be bipolar. I thought so. It was your aunt, not your mom. I just looked back. Interesting. Wait, this one's not found anymore? What? Hold on. I found something that's not even found anymore. That I probably linked in my last Just Chatting. Okay. Interesting. Yeah. What makes you think she has it, or might have it? If you don't mind me asking. And you don't mind saying. Okay. How does a psychiatrist diagnose bipolar? Okay. By evaluating a patient's symptoms, ruling out other conditions, and assessing the duration and severity of mood episodes. This process typically involves a combination of physical exams, psychological evaluations, and potentially biomarker testing. Oh, I looked this up before. Interesting. Okay. Now, I have to look this up. What is sinus tachycardia? Okay, sinus tachycardia is a condition where the heart's natural pacemaker, the sinus node, fires at a rate greater than 100 beats per minute. Oh, faster than normal heart rate, according to... Okay, I had to look this up. Hey, Starry, how are you doing today? Oh, I'm sorry to hear that, Pocket. I hope it doesn't affect you as much as it probably affects her and others. That's good to hear, Starry. I'm doing research about things. Like I've been doing. Okay. Oh, I understand that, Starry. Oh, I'm sorry, Pocket. Are you okay though? Do you need a hug? I'll give you a hug. You know what? I'll give you a hug anyway. Pretend this is you. Big squishing hug. It's often a normal response to physical activity. I understand that, Pocket. So, Starry, if you have any questions as well that you want me to look up and research, then feel free to tell me in chat, and I'll do that because I'm doing everything right now. Yeah, I have sinus tachycardia. My resting heart rate. Oh, okay. Thank you, Starry. I hope to see you streaming again soon. I don't know because I've been having troubles. Bye, Starry. Love ya. I have sinus tachycardia. My resting heart rate is 115 currently, which is just, I don't know why. Maybe it's overweight. Physical activity, stress, or other triggers, but can also be caused by underlying medical conditions or be inappropriately persistent, according to a cardiology. Okay, let's Cleveland Clinic. Okay. Sinus anemia. Oh, that's probably why I have it, because I could be anemic, low iron and stuff. Hyperthyroidism, I know I don't have. Heart failure, don't have. Okay, so it might be anemia. If I remember correctly, what is anemia? It's low iron. Oh no, where the blood has a lower than normal number of red blood cells or hemoglobin, which is a protein in RBC's red blood cells that carries oxygen. This deficiency can lead to reduced oxygen delivery to the body's tissues, causing symptoms like fatigue and weakness. Oh! So it's a shortage of healthy red blood cells or hemoglobin. Never mind, I was wrong. Okay. Shortage of healthy red blood cells. Okay, interesting. Let's see how it works. Red blood cells and hemoglobin are basically, I'm low on iron, kinda, you know? But it's not that. That's not what anemia is. Okay. Can't do it now, do it forever. Let me get a... Oh, Mayo Clinic, that'll work. Hopefully, I hope. That'll work. Healthy red blood cells. Okay. Got it. Sinus tachycardia. SVT is supraventricular tachycardia. Has similar symptoms, but is usually caused by things you can control. So, like weight, maybe? I don't know. Sinus tachycardia with PVCs, premature ventricular contractions, and sinus tachycardia with PACs, premature atrial contractions. Can give you a feeling of racing or pounding heart palpitations. However, these extra heartbeats are normal, not a case for concern. That's good. Ventricular tachycardia can be dangerous and may require CPR when the person is having chest pain and trouble breathing. Who does sinus tachycardia affect? Anyone can get it as a normal. That's causing you stress. Oh, that could be why. Your body reacts to something stressful that's happening, such as fear, nervousness, fever, intense exercise, certain drugs, dehydration. Oh, I might be you know what? Before anyone tries to hydrate me, I'll hydrate myself. Overactive thyroid, which is hyperthyroidism, damaged heart muscle, anemia. What? Oh, yeah. Okay. Heavy bleeding. Interesting. Okay, where were we? We were over here at first, but we're already past that. So we're already past that. So sinus tachycardia is very interesting, actually. Oh, now I'll know what a normal heart rate is. Hold on. Between normal versus inappropriate, whatever. It's between 60 and 100 BPM at rest. 60 and 100 BPM, if I can spell right. BPM at rest. Okay. So it probably isn't too bad. I wouldn't be afraid of it. I just wanted to know if, because nobody told me, oh, this is bad, we need to do surgery or something. I was just wondering what sinus tachycardia was. And I think I already got the common causes for that. Okay. Do root canals hurt after? Okay. It's normal to experience some discomfort or mild pain after root canal, but it's usually manageable and temporary. Most people experience only minor soreness that subsides within a few days. Any severe or persistent pain beyond a few days or signs of infection should be addressed by a dentist. Okay. Usually yes for root canals. I mean, you know what? Let's look if they hurt like during. Root canal procedures themselves typically do not hurt as they are performed under local anesthesia. Oh yeah, they use a needle. Any pain experienced after a root canal is usually mild and manageable with over-the-counter pain relievers. What do you mean code is so picky? What's your code or trying to code? What the fuck is this? Procedure and recovery. There we go. Oh, I'm not good at coding, so I have no idea what you just put. Ooh. Okay. You know what? You guys ready? I have an idea. If it goes into real stuff, I'll be pissed because I did no, I did a root canal video before. You know what? Let's watch another one. Hold on. Why can't I hear anything? Okay, no, speakers are fine. It's just muted. Okay, I guess we're watching it like this. You know what? Let's watch it on YouTube. I don't care. Hold on. Hi, Drew. How are you today? My eyes. This is a lame video. I'm not even gonna link that. I'll just link this page. I don't give a shit. Oh wait, shit. Sorry, hold on. Chatting. There we go. Ah, I see. I should be getting a root canal soon, only because the reason I got my wisdom teeth taken out is just so I could get a root canal properly. You know, a root canal proper. What is a root canal? Okay. A root canal is a procedure that removes an infected pulp from inside your tooth. So yeah, I have an infection in one of my teeth. Your dentist cleans and seals the canals to prevent further damage and save your tooth. You might need root canal treatment if bacteria reach the pulp and cause pain or inflammation. Do I need to? Because it doesn't cause pain or inflammation at all. Interesting. I could have a swollen jaw though. No! Pocket, you still need to get that fixed. I remember you telling me about that. I think I remember you telling me about that. Okay, I'm hoping. How do dentists get rid of wisdom teeth? Sorry, I needed to know this because I don't know how they do it, you know? Wisdom tooth removal. Please give me a video or something that's not like a live action. Ah, there's an animation. There's an animation, guys. Hold on. I'm on the wrong thing, aren't I? Just chatting research. Never mind, I found it. Okay. If anyone feels uncomfortable with this, just let me know. I might need to turn it down a little though. No, it's fine. Oh, I'm sorry to hear that, though. I mean, that probably sucks ass.
Wisdom teeth are the last teeth to develop in a pin.
Okay, so before we go any further, there's an sorry. There's an issue here with my teeth. Before I got wisdom teeth removal, that tooth. Hold on, can you guys? You guys can't see my my thing. Hold on. Oh no, it is capturing your cursor, right? Well, basically, my wisdom teeth, every single last one of them. I think. Why is this not working? Oh, what the fuck just happened? Uh-oh. Hold on. Okay. So this tooth right here went into this tooth over here, if you guys can see that. And it was an impacted tooth, basically. And it left an infection underneath the tooth right next to it. So, yeah. They wanted to nip it in the bud so nothing else happens like that.
They usually erupt between the ages of 17 and 25. Impacted wisdom teeth are unable to erupt into the mouth, either due to lack of space or their position. An impacted wisdom tooth may be painful and can contribute to problems such as infection, damage to neighboring teeth.
Yep, that's what happened to my tooth. But it started at the bottom of the root on this side, I think, if I remember, which is my left, for people that don't see it. But it's like right there. I think it's healed properly. This side feels like the area where the wisdom tooth is still open, but I could be wrong, you know.
Tooth decay, periodontal disease.
What's periodontal disease? Let me write that down. I'll look that up afterwards. What is periodontal disease? Okay, sorry about that.
Bone loss and loosened teeth.
Yeah.
More serious problems like cyst formation
Oh!
and more surgery could occur.
That actually looks painful just looking at it. Oh, nope, we're snoozing that ad. Snooze that ad.
Pain-free does not mean disease-free.
Oh, okay. Well, that makes sense.
During the consultation, comfort.
I actually had I had that. They had that to like x-ray my teeth basically. Thing is, I'm so big that the back of it, because it turns like this basically, hit my back. So what you have to do is, you can see she's like biting on something, you know.
Comprehensive oral examination is done, as well as X-ray
That's a pretty neat x-ray.
examination to verify the position of wisdom teeth.
Oh my god, I have to tell you something. I've never had a tooth removed until I had wisdom teeth surgery. And it hurt like a motherfucker afterwards. It didn't hurt while I was doing it because I was put under. But like, oh, afterwards, I wanted food to eat, like actual food, but I couldn't yet, so I had to call a few times. And to stop, to make sure there's no, what was it called? Dry something? Dry socket. I couldn't use this for a while. And it was killing me. I don't know why. Maybe I am a baby, I don't know.
The removal of wisdom teeth is usually an in-office procedure
Why does this look like an office that I've been in?
done with intravenous sedation. With a scalpel blade, an incision is made in the gum margin around the second molar tooth.
Huh.
This is continued behind is sometimes split in half, with the burr to enable easier retrieval with an instrument called an elevator. The bony crypt that housed the wisdom tooth is then cleaned with saline water, and the dog flap is laid back and sutures are used to hold this in place.
Okay.
After surgery, you will be given written.
Oh, I followed all of them. I followed all of them carefully. Don't worry about that. They said nothing about talking too much, you know. So the next day I did stream. For a bit, at least. That wasn't a bad video, actually. I really like that. That actually helped me a lot. Just doing this. Okay, good. And now... we go back to just chatting. That was very interesting to learn, if you ask me. Oh, if I can spell that. What is periodontal? If I can spell it, periodontal disease. And I won't be doing a video on that, so. Periodontal. Oh, I read that wrong. Yeah, I spelled it wrong too. Periodontal disease. Okay. Let's see. Also known as it's gum disease. There's a bacterial infection that damages the soft tissues and bone that support your teeth. Okay. So it's gum disease. Medical term for gum disease. That's good to know. Let's see. I don't have any other questions. Oh, wait, no, I do. Oh, no, I already looked up if root canals are. Never mind. Anyone else have any questions? Because I can quickly do that. Okay, and bone that support your teeth is a progressive condition, meaning it worsens over time if left untreated. If not addressed, it can lead to tooth loss. Okay, here we go. Let's keep this so I can link that as well. Oh, okay, I see. That looks disgusting. Gingivitis, normal gingivitis, mild, moderate, and advanced. Ugh. I could play a game right now, but I don't know what I'd want to play. You know what? Let's open up Steam real quick just in case. Let me check if I did everything already. Yep, I looked up everything I wanted to look up already. Yeah, that's good. Okay, I looked up everything. Anyone have any questions before I possibly switch to a game? I don't know if I want to switch to a game though. Let's see, what did I have planned? I had just chatting planned for tomorrow just in case. So let's get rid of that. You know what? I do have to play that at some point. Let's see what happens first. Or what gets gotten rid of first. Okay, right here. You know what? I know what I'm doing. Okay. Okay, Pocket. When you're back, you'll see something else. Let me just try to think for a second. Okay. Let me go to main.